morning, everyone.
Morning.
How are you doing?
Tired.
Sorry. So, my name is Tina, and as a public health worker, I have more than 7 year experience working alongside with healthcare system and public health in Vietnam. So today I'm glad to be here to introduce you a topic about measles outbreak and vaccine. So before we start, so right now we see so many newspaper and also Facebook. Everywhere they talk about measles outbreak, and let's go and see what is the measles.
Measles again. This is healthcare tragedies. There's an outbreak in Washington State right now. How? We don't know who patient zero is yet, but it's usually someone who visited a country where measles is more common. Then they start to spread it here. What we do know is that someone who was infected went to lots of public places, including schools, churches, an IKEA, a Dollar Tree, and a healthcare facility. And they spread it. How? In Clark County, about 8% of kids have exemptions for school for the vaccines. That's way higher than the national average of 2%. Measles is deadly. 1 out of every 20 children who has measles gets pneumonia. 1 in 1,000 gets encephalitis, and 1 to 2 in 1,000 dies. It is so easy to get measles. We've discussed R naught before. It's a term that describes the average number of people who are made sick by another person in an outbreak. A higher R naught means the disease is more infectious. Measles has an R naught of 18. That means without vaccination, 1 person with measles will likely give it to 18 other people. Someone with measles can enter a room, cough, and then leave, and then hours later, someone entering the room could still catch measles from breathing the air. In 1963, there were more than 4 million cases of measles, 48,000 hospitalizations, and 500 deaths in the United States alone. That's why we have a vaccine.
So after you see the video, anyone who concerned about the measles, or you have children? Yeah. So let's see on the data on the CDC website, and as like after in recent 10 years, we recorded in 2014 there are more than 600 cases of measles recorded, and in 2018 it's more than 300 cases. But those last 10 weeks of this year, we have 228 cases of measles reported in 12 states.
In America?
Yes, in America.
Oh.
Yeah. And at the recorded data from the US, and they recorded there are 3 main reasons for the measles outbreak. The first one is the traveler who have the measles and then who go to the state and spread it out to the community. And the second group is unvaccinated people who have to spread it out and get the measles from the people. And they also consider about the vaccine for children program. They have very important roles of parent as long as provider in the healthcare system. So that's why in my presentation I will show you about 3 main things why parents put the community at risk when they do not vaccinate their children. The first one is vaccine help to control measles. So let's see how vaccine work in our body. So the first thing, the measles vaccine typical combined with the mumps and rubella vaccine, and they call MMR vaccine. So, and this, when people get 2 doses of this vaccine, we can get about 95% of effective when we can prevent the measles when that individual exposed to the virus. So, and in the history of the measles and outbreak. Before the measles vaccine introduced in 1963, and before 1963, about 90% of the American children who were infected with the measles virus by the age of 15. So, and the periods, and 10 years later, about the periods in between 1963 to 1973, every year in the state they have recorded about 3 to 4 million people get the measles, and thus included 400 children have the correct disease after a disability after get the measles, and also cost 400 to 500 deaths every year. So that's the vaccine history. You can see how it big different. And after and by 2000, after the vaccine program very good in the state, so they record only a median about 60 cases of measles every year. But from 2014 and 2018 and this year, the measles outbreak again. And they also have found out that World Health Organization have many study and research found out that the refusal of the parents in vaccine have 4 reasons. The first is religion, and the second is the personal belief or philosophy reason, and they also concerned about safety concern. Have safety concern in vaccine, and also they have desirable to desire for more information from healthcare provider, and the cost of vaccine refusal that the people get more measles and outbreak in the community. And also we have the recorded vaccine refusal directly related to measles outbreak. And the third thing we consider about the risk for the community when the parents do not vaccine need for their children. So it will increase the mortality rate in the children. And the second is it will have the burden for the healthcare system. And the third is increase the economic burden for illness for every people and all the family who get the disease. And one thing is raise up many questions about the effective of vaccine. So in some reasons the people in community did not get vaccine for their children because they think that vaccine is harmful and make people die. But the research show that in fact in some case in the community we have recorded some case die after they get vaccine because they have some other reason combined together. But in the history and also the data during many years after the vaccine interrupt, and we see that vaccine is safe and very effective for preventing the measles outbreak for the community. So that's why the parents should immunize their children, because they should protect their children's health, and then they can prevent the measles outbreak to the community. And the third thing is they can reduce the risk for on the community. So that's it, my presentation. Thank you for the listening.